Welcome back to Daytime, everyone. The body has an incredible ability to heal itself. Yet most of us are in the dark about how to tap into this self-healing power. Dr. Fab Mancini is an internationally acclaimed wellness leader, educator, and authority on self-healing. His best-selling book is called The Power of Self-Healing. Dr. Mancini, welcome to Daytime. Good to have you here.
I'm so excited to be here.
You say the pain we feel in our bodies is like an alarm system. An alarm for what?
Well, the problem right now is that most of us are actually viewing pain as the enemy. But actually, pain is really our best friend. And I want to show you this. So,
okay.
You have a smoke alarm in your house?
I do, a couple.
So this is a smoke alarm. So I want you to think about that the sound in the smoke alarm, right, is just letting us know that there's smoke, that maybe there's fire behind the smoke, and that has some serious consequences. So when we hear this noise, right, it's extremely annoying.
It really is.
So what we do is that we immediately would just want to say, I want to just stop the pain.
Yes.
Do whatever to stop the pain. So I can actually cover the speaker and I don't hear it anymore.
It's much better.
And that what most of us do is that we just want to do pain medication and just numb the pain, but it doesn't take care of the problem, right? It doesn't take care of the smoke.
We treat the symptom, not the cause.
Right. That's the main thing, is that the pain is just there to let us know there's a problem. But even worse, sometimes we go in and take the battery out.
True, we do.
And that could be like maybe an unnecessary surgery. Just cut it out. Just get the pain out. And that problem is that even when we do that, it doesn't take care of the cause of the problem. So by not listening to the pain, then what happens is that we are just kind of treating the symptom but not getting to the cause.
You say stop, drop, and roll.
Well, this is a funny thing. It's like, you know, when we're little, we're taught how we should deal with fire, stop, drop, and roll. Well, the first thing I want you to do is when you feel pain, I want you to stop. I don't want you to react to the pain and say, I just want that gone. I want you to be thinking about what got me here in the first place. What could be causing this pain? And the drop and roll is pretty much drop into your doctor's office and try to find out answers to where the pain may be coming from. But maybe you're not finding that answer. So you're going to drop in your chair and you're going to say, well, what could I be doing right now that's causing this pain? And the role is pretty much addressing the pain, primarily either physically, emotionally, or spiritually, because the cause, you know, I'm a chiropractor, and pain, the most common pain is back pain. Over 80% of a million Americans are going to suffer from back pain. So what I tell the patients is that we're going to find out where the pain is coming from, and it may not be coming from your low back, and typically it isn't. So the main thing I want you to understand is, when you look at the pain, don't look at it as an enemy, but just as a friend trying to warn you there's something going on, so get to the cause of the problem.
A lot of people don't want to wait that long, though. They don't want to they don't want to go down that road and explore that path, because really all they care about is give me a pill now so that I don't have to feel this pain and I can get a good night's sleep.
I know, but the challenge is this: what are the consequences when you're running through life just managing those symptoms rather than getting to the cause of the problem, which maybe the cause is something simple such as doing something different that's causing that pain?
Well, how do you get to the heart of the problem then? How do we find the source of the pain and what's causing this?
Well, that's the good question. You have to evaluate it both. And this is really pretty much what I have found over 25 years of experience, is you have either a physical cause, an emotional cause, or a spiritual cause that is causing that pain. And you just have to get in there and say, okay, is it an activity that I'm doing? If you're a golfer and you're swinging, that could be causing a herniated disc. Well, maybe you just need to stretch real good after the golf game in order to counteract the swing of the golfer. Well, if you don't know any better, you keep swinging and swinging it to the point that a doctor says, well, you can't play golf anymore because you have a herniated disc.
Is most pain treatable?
Yes.
To get to the real source and to make it stop?
Yes.
Without surgery?
Yes. And all it takes is just a little bit of effort, and primarily shifting the way we look at pain, not as the problem, but actually just the warning sign, just like the smoke alarm, telling us, hey, there's something going on that we need to dig deeper, and you need to do some investigation. And if somebody from the medical community says, here, just take this pill and see you later? Well, or you can get a second opinion. Yeah. You can get a third opinion. And primarily, you got to make sure that it's not necessarily just to get rid of it immediately, but really try to get to that cause. All right, Dr. Mancini, thank you very much. Dr. Mancini has a self-healing gift for our audience today. Just go to drfabmancini.com/daytime, and you'll find all the information there. Thank you very, very much. My pleasure. Daytime will be right back.